Well, pain management is actually a very new specialty. It's one of the newer specialties in medicine. And pain specialists really come from a few different specialties. They come out of anesthesiology, physical medicine, rehab, or where most of them first train. But there are specialists that treat people who have pain.
One, it can be your weekend warrior who's out playing with his or her children, playing football or raking too many leaves, shoveling too much snow. That's someone that I will see. The phones on Monday are always full of those type of phone calls. The other patients that I'll see are some patients that are over the age of 50 that have a chronic problem, that notice they can't walk as far as they used to, that they have chronic back pain if they're trying to prepare dinner or standing still for a little while. They notice they're standing at a grocery store and they're getting antsy because the back pain is becoming more prevalent. Those patients are the ones that I will wind up seeing.
What you really shouldn't do is really escalate your medication use, even with over-the-counter medications, because over-the-counter medications can be very dangerous. There are now studies showing that just using Motrin on a regular basis in high doses can significantly increase your chance of heart attacks, stroke, kidney disease, high blood pressure, even to the point of kidney failure. Using excessive doses of Tylenol can lead you to develop a hepatitis that can potentially be fatal. So if basic things like rest, ice, and elevation don't help you, then you really should seek out medical care.